Hi, Dr. Thomas. My name is Tando Chen, and I will be the medical assistant today for your visit. So before we start, do you mind just tell me your name and your date of birth, please?
Sure. I'm Aaron C. Thomas, and my date of birth is 12 March 1980.
Okay, thank you for that information, Dr. Thomas. So, how are you doing? What's your reason for visit today?
So I came in today because I've been dealing with a headache for a little while, and it's not like a new thing for me. I haven't experienced that before, so I wanted to come see about it if it was something in my gut or I don't know.
Okay, yeah, we can definitely help you. So the medical provider can definitely help you with that. So before a medical provider comes in, I have a few questions that I want to ask related to the headache that you experience. So I'm wondering, since you say you have been having this for a while, so do you mind just telling me how long have you been experiencing it and when did it start?
Sure. I would say like 3 weeks. It's been about maybe a little longer, maybe like 25 days, 26 days.
Okay.
It started like, uh, I don't know. I mean, to me, it started like when the weather changed.
Okay.
I have a weird, like it got cold. Maybe actually I came back from Los Angeles to Tallahassee and my body's being weird. I don't know.
Okay, I see. You said do you always travel back and forth from Los Angeles to Tallahassee?
Not usually.
Is it?
Oh, sorry.
So this is not your. Is this your? And you mentioned this is your first time that you experience a headache like this, right?
Yeah.
Okay. So do you mind just describing your headache characteristic? Is it like in the front, in the back, or is it like one side of the pain?
It feels to me
both
like
sides of
on the
pain?
top of my head, like in the center of my head, more like
Mhm.
in the brain,
Oh,
like
okay.
below the main part of the top,
Okay.
like in a building, like a dome, like in the center of the church or something.
Okay, I see. So since you mentioned you feel like a strong pain, so from 0 to 10, 0 means like I don't feel pain at all, and 10 means the most ever painful experience that I ever experienced. So what would you rate your pain?
I think it's more like a 6, but it's happening all the time, so it just makes you tired. It like
Okay.
tires me out.
So when you say it happens all the time, so is it like happen? So for example, you say you have been experienced this like for 25 days or 26 days. Like, is it like happening all the day, or it just happens
see what
during
you're
a
saying.
specific time period?
Yeah, I feel like it's sometimes I wake up with it and it's like an aching, and it sort of goes away during the day, but maybe comes back at night. So I feel like weird, like it happens in the morning, and then sort of goes away until maybe 4 p.m. and it comes back, and yeah, it's very weird to me.
So for example, do you experience like, for example, when you, based on your description, so the light is actually alleviating factor for you, or is it like makes more painful?
Yeah, the light I don't think is related. It doesn't bother me, the light. It feels like something else.
Okay. So have you taken any like over-the-counter medication like
Yes.
to alleviate the pain?
Yes, I've been taking ibuprofen.
Mm-hmm.
I don't like taking ibuprofen. I hear it's not good for the stomach, but I've been taking it.
So do you think the ibuprofen is helping, or is actually
I do think it's helping.
Does it give you any stomach pains?
No.
Okay. So are there anything else that you think you pain is alleviating, like from normal activity, anything, or is it just, or you don't feel, if you don't feel any alleviation from anything that you're doing? Or are there any factors that actually you think like aggravate
I've been
headache?
wondering if it's like more activity is making the headache sort of go away, and this sedentary sort of, that's, you know, that like as I move through the day, maybe it's, you know, going away. I'm not sure.
Okay, that's fine. Are there any other symptoms like besides the headache? Do you feel nausea, vomiting, or anything?
I haven't
fever?
been. No.
Okay.
No fever.
No.
Not really vomiting.
That's good.
Yeah.
So only headaches.
Mm-hmm.
Okay, those are like good responses, but I have some like past medical history question that I want to ask you just to see a comprehensive check when I give all the notes like to the medical provider. Do you mind if I ask some of those questions?
Sure, that's fine.
So, do you have any medical history that you would like to share?
I don't have any. My like high blood pressure runs in my family.
Okay.
But I don't think anything in my own history affects it.
Okay. So are you
No, I'm not like, I had not had surgery or anything.
Okay. Are you currently on any medications?
No. Well, the ibuprofen.
Okay, yeah, definitely. So do you experience any allergies?
Mm-mm.
Okay, those are good. I'm going to relay all of my notes to the medical providers and they will come in to check you shortly.
Okay.
That's me, Dr. Thomas.
Thank you so much.
Of course.